Did you know that almost everyone used to get chickenpox as a child? It was almost a universal experience, with most kids catching it before they even reached their teenage years. It was so common that it was considered a childhood rite of passage, something that nearly every child went through. Thankfully, things are different today. Modern medicine has made significant strides in preventing this once ubiquitous illness. With the introduction of the chickenpox vaccine, the number of cases has dramatically decreased, making chickenpox much less common than it used to be. But chickenpox is still around, and it's important to know what causes it and how to treat it. Awareness and knowledge are key to managing this illness effectively. Chickenpox is a highly contagious disease that causes an itchy rash all over the body. The rash can be quite uncomfortable and distressing, especially for young children. It's most common in children under the age of 10, but people of any age can get it. Even adults who never had chickenpox as children are at risk. While chickenpox is usually mild, it can be serious, especially for babies, adults, and people with weakened immune systems. Complications can arise, making it more than just a simple childhood illness. If you're not sure what causes chickenpox or how to treat it, you're in the right place. Understanding the basics can help you take the right steps if you or a loved one gets sick. In this article, we'll explore everything you need to know about this common childhood illness. From prevention to treatment, we aim to provide comprehensive information. From the virus that causes it to the latest treatments available, we've got you covered. Our goal is to equip you with the knowledge you need to handle chickenpox confidently. Let's start by diving into the root cause of chickenpox, the Varicella-Zoster virus. This virus is responsible for the characteristic rash and other symptoms associated with chickenpox. Chickenpox is caused by a virus called Varicella-Zoster. This virus is highly contagious, meaning it spreads easily from person to person. The virus travels through the air in droplets when an infected person coughs or sneezes. It can also spread through direct contact with the blisters of someone who has chickenpox. Once you're infected with the Varicella-Zoster virus, it usually takes about 2 weeks for symptoms to appear. This is called the incubation period. During the incubation period, you may not even know you're sick, but you can still spread the virus to others. This is why it's so important to be aware of the symptoms of chickenpox and to take steps to prevent its spread. Now that you know what causes chickenpox, let's take a closer look at the symptoms you can expect if you or your child contracts the virus. The most recognizable symptom of chickenpox is the rash. It starts as small red bumps that look like insect bites. These bumps quickly turn into fluid-filled blisters that are very itchy. The blisters can appear anywhere on the body, including the scalp, face, mouth, and genitals. Besides the rash, chickenpox can also cause other symptoms, including fever, headache, fatigue, and loss of appetite. For most healthy children, chickenpox is a mild illness that goes away on its own within a week or two. However, some people can develop complications from chickenpox, such as skin infections, pneumonia, and encephalitis, which is inflammation of the brain. These complications are more common in infants, adults, and people with weakened immune systems. Next, let's understand how this contagious virus spreads from person to person. Chickenpox spreads very easily from person to person. The virus travels through the air in tiny droplets when an infected person coughs or sneezes. You can get chickenpox by breathing in these droplets. You can also get chickenpox by touching the blisters of someone who has it. Chickenpox is most contagious from 1 to 2 days before the rash appears, until all of the blisters have crusted over. This means that a person with chickenpox can spread the virus before they even know they have it. There are a few things that can increase your risk of getting chickenpox, including not being vaccinated against chickenpox, being in close contact with someone who has chickenpox, and having a weakened immune system. Now that we understand the transmission of chickenpox, let's explore the various treatments and remedies available. Section 5. Soothing the itch, Calamine lotion, and oatmeal baths. While there is no cure for chickenpox, there are several things you can do to relieve the symptoms and prevent complications. It's important to manage the itchiness and discomfort to avoid further issues. One of the best things you can do is to soothe the itch. This can significantly improve your comfort and help you get through the illness more easily. The itchy blisters can be incredibly uncomfortable, but scratching them can lead to infection. This is why it's crucial to find effective ways to manage the itch. Calamine lotion is a popular over-the-counter remedy that can help relieve itching. It's widely recommended by healthcare professionals for its effectiveness. It contains zinc oxide, which has a cooling and drying effect on the skin. This can provide immediate relief from the itching sensation. Apply Calamine lotion to the blisters with a cotton ball as needed. Make sure to cover all affected areas for the best results. Another soothing option is an oatmeal bath. This natural remedy has been used for generations to treat various skin conditions. Oatmeal has anti-inflammatory properties that can help calm irritated skin. It's a gentle and effective way to reduce itching and redness. To prepare an oatmeal bath, add 1 cup of colloidal oatmeal, which is finely ground oatmeal, to a warm bath. Stir the water to ensure the oatmeal is evenly distributed. Soak for 15 to 20 minutes, then pat your skin dry. Avoid rubbing your skin with the towel to prevent further irritation. These simple remedies can go a long way in managing the discomfort of chickenpox. By taking these steps, you can help your skin heal and feel more comfortable during the recovery process. Section 6. Antiviral medications, a helping hand for severe cases. In some cases, your doctor may prescribe antiviral medications to help shorten the duration of chickenpox and reduce the severity of symptoms. These medications work by stopping the Varicella-Zoster virus from replicating in the body. Antiviral medications are usually only recommended for people who are at risk of developing complications from chickenpox. This includes infants, adults, and people with weakened immune systems. If you think you or your child may need antiviral medications, it's important to see a doctor right away. Early treatment can make a big difference in preventing complications. Section 7. Home remedies, tried and true comfort measures. In this section, we will explore some of the most effective and time-tested methods to alleviate the discomfort caused by chickenpox. In addition to calamine lotion and oatmeal baths, there are several other home remedies that can help relieve the symptoms of chickenpox. These remedies are simple yet effective and can be easily prepared at home. These remedies have been passed down through generations and can provide comfort and relief. They are often shared by family members and have stood the test of time due to their effectiveness. Cool compresses. Apply a cool compress to the itchy areas for 10 to 15 minutes at a time. This can help reduce inflammation and provide immediate relief from itching. You can make a cool compress by soaking a washcloth in cold water, wringing it out, and then applying it to the skin. Repeat this process several times a day for the best results. Baking soda paste. Baking soda has anti-inflammatory and drying properties. It can help soothe the skin and reduce itching. Mix a small amount of baking soda with water to make a paste. Ensure the paste is thick enough to stay on the skin without dripping. Apply the paste to the blisters and let it dry. This can help dry out the blisters and reduce the risk of infection. Honey. Honey has antibacterial and wound healing properties. It is a natural remedy that has been used for centuries. Apply a thin layer of honey to the blisters to help prevent infection and promote healing. Make sure to use raw, unprocessed honey for the best results. Remember to consult with your doctor before trying any new home remedies, especially if you have any underlying health conditions. Your doctor can provide guidance and ensure that the remedies are safe for you to use. Section 8. Prevention is key. The chickenpox vaccine. The best way to prevent chickenpox is to get the chickenpox vaccine. The vaccine is very safe and effective. It contains a weakened form of the Varicella-Zoster virus that helps your body build immunity to the virus. The chickenpox vaccine is given in 2 doses. The first dose is given between 12 and 15 months of age, and the second dose is given between 4 and 6 years of age. The chickenpox vaccine is very effective at preventing chickenpox. In fact, most people who get the vaccine will never get chickenpox. If you do get chickenpox after being vaccinated, the symptoms are usually much milder than in people who have not been vaccinated. Section 9. Chickenpox in 2024. What's new? In 2024, the fight against chickenpox continues. While the chickenpox vaccine has significantly reduced the number of cases, research is ongoing to develop even more effective prevention and treatment strategies. Scientists are exploring new antiviral medications that target the Varicella-Zoster virus with greater precision. These medications aim to minimize side effects and provide faster relief from symptoms. Furthermore, researchers are investigating the long-term effects of chickenpox on the body. Studies are underway to determine if there is a link between chickenpox infection and the development of certain autoimmune disorders. As our understanding of chickenpox evolves, we can expect to see further advancements in treatment options and preventive measures. Section 10. A final word: your health, our priority. Chickenpox, a once common childhood illness, is now preventable thanks to the chickenpox vaccine. While most cases are mild, it's crucial to understand the causes, symptoms, and treatment options associated with this contagious disease. Remember to practice good hygiene, such as frequent hand washing, to prevent the spread of the Varicella-Zoster virus. If you suspect chickenpox, consult a healthcare professional for proper diagnosis and treatment. Your health and well-being are our top priorities. By staying informed and taking necessary precautions, we can minimize the impact of chickenpox and ensure the health of our communities. Section 11. Let's talk chickenpox, share your story. We've covered a lot of ground about chickenpox, but we want to hear from you. Have you or your child ever had chickenpox? What remedies did you find helpful? Share your experiences and questions in the comments below. Your insights could help others navigate the ups and downs of this common childhood illness. Let's create a supportive community where we can learn from each other and prioritize our health.